Good morning, everybody. On this rather beautiful day here in Washington, D.C., a little humid, but otherwise beautiful. I'm Bernie Rosof, chair of the Roundtable on Health Literacy of the National Academy of Science, Engineering, and Medicine. It was always easier when I used to say IOM. I'd like to welcome everyone to today's workshop. The title of the workshop is Health Literacy and Health Insurance Literacy, How to Move Forward. I also want to let everybody know right from the beginning that this meeting is being recorded and videotaped for webcast across the internet. The mission of the Roundtable on Health Literacy is to inspire, to activate a wide variety of stakeholders to develop, implement, and share evidence-based health literacy practices and policies with the goal of improving the health and well-being of all people. As one of its major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and issues of concern, such as the focus of today's workshop, the relevance of health literacy and health insurance literacy to health insurance reform. It seems rather basic, but I think as we go through the day, you'll see its importance once again. Since the passage of the Patient Protection and Affordable Care Act, healthcare reform has really created major changes in the healthcare system in this country. It has brought millions of people into the system who had not previously had access. Many of these individuals have limited knowledge, limited understanding, and limited ability to navigate the health system, perhaps also true for many who were already insured, and I'm sure that's exactly so. In addition, many of the individuals with new access are from populations that traditionally had low health literacy. The Roundtable has already engaged in a number of activities related to healthcare reform. For example, in 2010, we commissioned a paper on the health literacy implications for the provisions of the Affordable Care Act. This paper was presented at a workshop we convened to explore the challenges and the opportunities for health literacy within the context of healthcare reform, and is included in the published summary of the workshop. By the way, there are a number of copies of some of the past papers out front. I'm sure you'll all enjoy taking them with you and reading them for the future. In 2012, we published the summary of a Roundtable workshop that focused on how health literate practices could facilitate state health exchange communication. In 2013, we were still working hard. Members of the Roundtable produced 3 discussion papers on the topic of healthcare reform, which were published by the Institute of Medicine. The first, Helping Consumers Understand and Use Health Insurance in 2014, presents basic information that can be used to help people understand their health insurance options. This paper is a resource for those who will be helping consumers make important and informed decisions for patient navigation, community organizations, employers, media educators, and any individual or any organization working to improve understanding of the options for health insurance. The second paper, Amplifying the Voice of the Underserved in the Implementation of the Affordable Care Act, delivered 2 messages. One about the importance of amplifying the patient voice, and the other about the importance of communicating to different types of communities in meaningful and understanding ways. It seems rather basic, but how important that is. The third published paper, Let's Ask For, Questions for Consumers and Providers About Health Insurance, addressed 4 questions. What are my options for health insurance? How do I get it? How do I use it? And what will it cost? Then, in 2014, the Roundtable commissioned a project to identify strategies that were successful at enrolling individuals from hard-to-reach populations. The project was funded by the Blue Shield of California Foundation, and the report, Successfully Engaging Hard-to-Reach Populations in Health Insurance, a focus on outreach, sign-up and retention, and use, is partially based on interviews the authors conducted with individuals from states and cities that were active in engaging and enrolling specific hard-to-reach populations. And again, that's an issue that we're undertaking today and in the future. The paper focuses on strategies that worked. We use success stories in this paper, which made it that much more of importance. All of these reports and papers, with the exception of the first, as I mentioned a few moments ago, are available at the registration desk. But should you not get it there, you can download them free from the Roundtable webpage, which, as you know, is nationalacademies.org/health-literacy RT. So today, the Roundtable has the opportunity to revisit the topic of health literacy within healthcare reform by exploring the ways in which healthcare reform has been implemented, noting the successes, noting the failures, and identifying the role of health literacy and health insurance literacy in the implementation of the healthcare reform initiatives. I don't know how many of you have read your payer material when you get your health plan at the end of the year, at the beginning of the year, but I read it every year, and every year I never understand it. So perhaps this will be helpful. The workshop was organized by a planning committee, the members of which are Judy Hibbard, Katina O'Leary, Kavita Patel, Lynn Quincy, and Michael Valere. Important to mention, as I do at every meeting, is that I'd like to ask Roundtable members to be thinking during the day about, and very carefully, about the key points you think are important to highlight. Because at the end of the day, as you will remember, I'll be asking each of you to provide us with 1 or 2 sentences. That usually means a little bit more, but 1 or 2 sentences about important points made during the morning and afternoon. Sort of what I call the morning Joe question, what did you learn today? We'll begin the workshop with a presentation followed immediately by a panel discussion. The presentation will be made by Ms. Karen Politz, who will focus on what are some of the lessons learned over the past 3 years of implementing health insurance reform. Ms. Politz is a senior fellow at the Henry J. Kaiser Family Foundation, where she directs and sponsors research related to consumer protection and transparency in private health insurance. A more complete biographical sketch is available in the handouts. And by the way, there'll be biographical sketches for all our speakers and most everybody else in the audience here, which will be available in our handouts. The panel following this presentation will focus on an exploration of issues, an exploration of challenges, and an exploration of future needs. This will be moderated discussion of some specific questions, which will be led by Dr. Terry Davis of our Roundtable, who will introduce each of the panelists a bit later. Dr. Davis is a professor of medicine and pediatrics at Louisiana State University Health Science Center in Shreveport, Louisiana. Again, as I mentioned earlier, further information about Terry is contained in the handouts. I also ask that each of you please hold your questions until the conclusion of the panel discussion, at which point we will take questions and answers from both Ms. Politz and the panel members. I also want to please identify yourselves when you come to the microphone, or even if you're at your seats. It's important for a variety of reasons, including our videotapes. We also have a timer, which is somewhere here. It's never on when I'm here. But there is a timer, and it'll turn yellow when presentation time is nearing the end, and red when the time is up. So it helps us to keep our meeting on time. So Ms. Politz, welcome. And let me ask you to come to the podium, and we can begin.